Hello, bonjour, quoi. Today is a celebration as we applaud the incredible achievements of people in recovery. Aujourd'hui, nous saluons les remarquables réussites des personnes en voie de réadaptation. Everyone in life has their own path, and for me, I am celebrating the second Recovery Day in a row with someone close to me who is in recovery, despite the stresses of COVID-19. And Gord has taught me that these things are worth celebrating publicly. Currently, many eyes are focused on the COVID-19 pandemic, but despite this, Ottawa Public Health has not wavered in our recognition and support for individuals who live with problematic substance use or a substance use disorder. In fact, we recognize that COVID-19 has exacerbated many of the issues that members in our community who use alcohol and drugs experience. Nous sommes conscients que la COVID-19 a amplifié nombre des problèmes qui éprouvent les membres de notre collectivité qui consomment des drogues ou de l'alcool. Ottawa Public Health has heard that during the COVID-19 pandemic, people have had trouble knowing where to reach out for mental health supports or addiction supports. We've also seen an alcohol consumption by some and a similar pattern in prescription and non-prescription drug use. So this is concerning to us. Unfortunately, problematic substance use, in particular the opioid crisis, continues to take lives across Canada. So we recognized this recently on International Overdose Day, which is another important day to remember why we stay committed to recovery and other supports. The presence of a toxic drug supply persists, and people continue to report barriers accessing the services they need. We know stigma is one of those barriers, and this stigma needs to end. Nous savons que la stigmatisation est un obstacle majeur. Il faut y mettre un terme. We must continue to work to support people who use substances and their journey across a continuum of increased wellness. We're dedicated to creating a society without walls where all community members can get access to equal and judgment-free help. This includes men in their middle ages, where we do see some of the greatest risks. Our current times have strengthened Ottawa Public Health's resolve to raise awareness of overdose and reduce the stigma around substance use. Now more than ever, it's a time to come together as a community. Il est maintenant plus que jamais temps d'unir nos efforts en tant que membres d'une même collectivité, de sensibiliser la population et réduire la stigmatisation face à la toxicomanie. I must say thank you to the incredible agencies such as the Community Addictions Peer Support Association, the Drug Users Advocacy League, the Canadian Centre on Substance Use and Addiction, and the Canadian Public Health Association, as well as the Royal Ottawa Mental Health Centre. We are very pleased to be collaborating with these partners and city partners to share a focus on this subject, and we especially value the conversations and collaborations we have directly with people with lived or living experience of substance use disorder. We recognize we can and we need to do more. Mais nous devons en faire plus. We are working together to make tangible improvements in mental health and eliminate harms from substance use with a focus on opioids across the lifespan through the Ottawa Community Action Plan. As part of this plan, Ottawa Public Health is partnering on a collective impact project with the Canadian Centre on Substance Use and Addiction and the Community Addictions Peer Support Association and the Royal. And this project is focusing on ending stigma and emphasizing the importance of using person-first language. So Ottawa Public Health heard from you that accessing programs for recovery can be difficult and that there is inadequate capacity to meet the demand, a lack of services in some locations, and that timely access to service is not always available. So I know personally that different solutions are needed for different people. And Safer Supply Ottawa partners are continuing to work to expand access to programming in the community to decrease the risk of accidental overdose and to improve health. So these services provide access to prescribed pharmaceutical opioids, and then they further connect people who use drugs to integrated wraparound health, social, and treatment services. Safer Supply Ottawa is supported by Health Canada's Substance Use and Addictions program. And I'm also pleased to say that Ottawa Public Health supports the Counseling Connect program, which provides same-day or next-day counseling. It was launched by the Ottawa Health Team and a handful of community partners to address this important need for timely access in our community. Services can be accessed through counselingconnect.org. The pandemic can affect individuals differently, so it's okay to not be okay. La pandémie peut affecter chaque personne de manière différente. Il est tout à fait normal de ne pas se sentir bien. And it's normal for situations like COVID-19 to affect your well-being. So I encourage you, support your friends and family, seek support yourself by checking in, sharing information, accessing available services. Physical distancing doesn't mean you have to be alone. La distanciation physique ne signifie pas que vous devez rester seul. We've made progress, but there's still more work to be done to shift the behaviors and attitudes of our community towards people who use substances. And we need to ensure that people have the access to the support they need when they need it. Il reste encore du travail à faire pour changer le comportement et les attitudes à l'égard des personnes qui consomment les substances et pour faire en sorte qu'elles aient accès au soutien dont elles ont besoin quand elles ont besoin. Your experiences prove that recovery is real, available, attainable, and sustainable. I'm so happy to celebrate this with you. Merci, miigwech. Thank you.